name is Cassie Penn. I'm in Microbiology 2420 with Tina Lane, and today I'm going to be presenting my hepatitis A virus presentation, Awareness, Prevention, and Self-Care. The objectives today are to understand the hepatitis A virus pathology, the structure of the hepatitis A virus, how the hepatitis A virus infects the body, symptoms, the at-risk populations, disease prevention, and self-care. The hepatitis A virus is a non-enveloped, single-stranded RNA virus. It is a picornivirus virus from the genus Hepatovirus. It measures 28 nanometers in diameter with a smooth particle surface. It has a linear, single-stranded RNA genome with secondary and tertiary structures. The protein shell is composed of capsomere subunits. Each capsomere is made up of 5 protomeres, and each one of these protomeres is composed of 3 proteins. Here you can see a picture of the hepatitis A virus structure. Here's the capsid, and you can see the proteins. These proteins play a role when attempting to enter the host cell. It is a positive sense RNA. It uses messenger RNA that is translated into a protein upon entrance into the cell. Once infected, the cells present abnormal protein MHC class I molecules. Immune T cells recognize these abnormal proteins and begin cell apoptosis and cell death. Once ingested, the hepatitis A virus gains entry to the bloodstream through the epithelium of the oropharynx and the intestines. The virus multiplies with hepatocytes and liver macrophages. The target of the virus is the liver. It replicates by cytoplasmic division and gains entry to the host cell by attaching to a host receptor and beginning endocytosis. The hepatitis A virus is present in the blood after 7 to 10 days. The virus exits the host cell by rupturing the host cell wall. Transmission of the virus is most likely 1 to 2 weeks before the onset of illness when concentrations are higher in the stool. Transmission risk decreases and is minimal the week after the onset of jaundice, which we'll talk about in a little bit. The hepatitis A virus is very resilient and can resist denaturation from acid, drying, and temperatures as high as 56 degrees Celsius and as low as -20 degrees Celsius. It can remain viable for many years. You can destroy the virus by using chlorine, iodine, or boiling water. Humans are the only natural host of the hepatitis A virus. It has an incubation period of 1 month before symptoms become noticeable, with symptoms lasting up to 8 weeks. The virus actually causes the host's own immune system to kill infected liver cells, and this results in the symptoms. It is a very infectious virus and considered acute. It's generally not long-term, and once you recover from the virus, the person will have a lifelong immunity. The virus is transmitted through the ingestion of contaminated food and water, direct contact with a contaminated person. The most common symptoms are jaundice. Jaundice is an accumulation of the yellow bilirubin chemical in the body's tissues. The liver is responsible for processing bilirubin but cannot function properly when infected with the virus. This results in a buildup of the chemical in the blood and in the tissues of the body. Once a person is infected, you will usually see a yellow discoloration of the skin and the whites of the eyes. They will also have fever, fatigue, loss of appetite, diarrhea, nausea, abdominal discomfort, and dark-colored urine. Not everyone infected will have symptoms. Adults and children over the age of 6 will usually have more noticeable symptoms. Here you can see a picture of a person with jaundice. You notice the yellow discoloration in the skin and in the whites of the eyes. And here's a picture of the hepatitis A pathway as it goes through the body. Hepatitis A occurs throughout the world. It's regularly found in certain areas particularly Central and South America, Africa, the Middle East, and Asia. It has a higher occurrence in developing countries with poor sanitary conditions and poor hygiene practices. Others at risk for the virus are frequent travelers in high-risk areas, rural areas, illegal drug users, those needing blood transfusions, and homosexual men. Significant economical and social consequences can occur with this virus, with people infected being away from work for weeks or even months while recovering, and any food establishment identified with the virus can be impacted tremendously through revenue and production. There are two ways to treat the hepatitis A virus: preventative and self-care. With preventative care, you have the hepatitis A vaccine. Recommendations for vaccination are from the World Health Organization and are based on evidence-based practices using economical studies. The World Health Organization weighed the decision of making the hepatitis A virus part of routine immunization program against the burden of the disease. Other preventative care methods are to consider those who should be vaccinated, and you want to make sure you have adequate supplies of clean drinking water, proper disposal of sewage, and proper hygiene practices. The other method would be self-care. Once you have contracted the virus, there is no medicine to take, so it is very important to take care of yourself. This involves adequate rest, coping with the nausea that comes with the virus, adequate calorie intake. Suggestions are to have small, frequent meals, snacks, food, and juices with a higher calorie content. And you also want to be very careful to consider medications you take during this time. An example would be acetaminophen, which is very hard for your liver to process, and no alcohol consumption. So in conclusion, I hope you have a better understanding of the hepatitis A virus, the pathology, transmission, prevention, symptoms, treatment, and self-care. Ideally, this will lead to a greater awareness for immunizations, proper hygiene practices, disease prevention, and proper disease treatment. Thank you.